Good morning. At least it's morning where I am. My name is Brian McNulty. I am an LPC, licensed professional counselor. I currently work at the Ness Center in Mandeville, Louisiana. I'm involved in the intensive outpatient program here, the addiction services director. And one of the things that I've been toying with, the idea of toying with, is creating a series of videos um, to allow for patients in any of the groups that I'm not in to at least get some of the lecture information that I can provide, um, um, especially with regards to the PowerPoints that I've created in helping patients understand the neurobiology of addiction, and as well as the neurobiology of recovery and the neurobiology of relapse. A lot of the reasoning behind this is most view addiction as a substance problem, and recovery meaning the absence of that substance, uh, and and relapse again, the reintroduction of that substance. And while the substance is involved, it doesn't really help people understand the true nature of the illness, how to treat the cause of the illness, and continue to treat the cause. With a brain disorder, what's more important is identifying and understanding that there's a midbrain dysfunction in the midbrain with regards to dopamine production, dopamine receptors, free uptake of dopamine, anything in dealing with that. But and so recovery would mean stabilizing that midbrain. So what I'm going to try to do is explain precisely what addiction is, what mechanisms are involved in a very general way, for better understanding. I'm not a neurobiologist or neuroscientist. I'm not. I'm just a counselor. My job is to take this information and present it in a way that's understandable, digestible to your average patient. And it's a very ambitious goal, trying to get people to completely reconceptualize what they thought addiction is. Your whole life you've understood it as an alcohol or drug issue, problem. Then while it may be interesting to hear about it as a brain disorder, it might make a lot of sense. For it to really get in there and for them to truly grasp it, it has to be presented over and over again, and for them to internalize it and really grasp it. Now, a lot of people may think that the science of addiction, of treating addiction, of looking at it as a brain disorder, would put us at odds at traditional 12-step recovery. And that just is not true. In fact, if you read, there it is, the Big Book of Alcoholics Anonymous, it's actually very, describes the brain disorder of addiction really well. They don't know exactly what it is, but they describe it exceptionally well. So the goal is to stabilize the midbrain in treatment, and allow people to get the benefit of 12-step recovery upon leaving. And once again, many opportunities to discuss that in future videos. And this is a chronic progressive illness, and as such, episodic treatment is not going to be the answer. So while the initial treatment is fairly episodic, 6 to 8 weeks to 10 weeks, or even a little bit longer, and continuing care can go longer. It usually doesn't go on indefinitely, and that's why some sort of outside program would be really beneficial. And quite honestly, if Alcoholics Anonymous or any of the 12-step programs did not impact in a positive way that destabilized midbrain, it wouldn't be around today. People would, it does something, and it definitely has a benefit. Does it benefit everybody? Potentially. If you can hear the message, it will benefit everybody. But as we'll find out, that's not always the case where people can hear the message. And it's one of the reasons why a lot of people struggle. And unlike past treatment programs, we're going to choose not to blame the patient as to why they struggle. I don't know that for the most part, most people are trying to get well, trying to get better, doing what they can. The fact that they can't hear the message, or they don't seem to benefit from it, it's just real easy to blame them. Well, they didn't want it, they're not ready, so on and so forth. Our job should be to help get them ready. Our job should be to help through clinical interventions and medication interventions to help them hear that message, help them gain access. And so we'll have some discussions in the future regarding all these things. So, I wanted to keep this video under 10 minutes, just to keep from rambling on, which I feel like I'm starting to do right now. Because there's an awful lot to talk about, and going at this piecemeal, I think, is better than anything else. So, like I said, we'll see how this goes, and I, will post this and hopefully get feedback as to what else people would like to hear about. But I have a couple ideas of where I'm going to go next with this, in addressing I think it's time that we take full advantage of the research and science out there that helps describe what addiction is in order to treat it more effectively. We're not doing as good a job as we could. I'm not satisfied, and if other people are satisfied, like this is great, this is as good as we're going to get, I would challenge that as this is as good as we can get. I think we can get better. So anyway, once again, my name is Brian Milton. I'm a licensed professional counselor, the Addiction Services Director at the Ness Center in Mandeville, Louisiana. And until next time, thanks a lot.